Good morning. This morning I am going to have our health education for our parents, and our topic will be all about rheumatic heart disease, especially among children. So we are practicing as pediatric nurses. I am, by the way, Roy Gallardo, second year student, nursing student of the CPAC, or the Central Philippine Adventist College. So talking about rheumatic heart disease, here are some key facts about RHD according to the World Health Organization. So first, RHD is most common acquired in people under the age of 25. It claims 291,000 lives each year, especially in low and middle income countries. So the disease results from the damage of heart valves caused by several episodes of rheumatic fever or possibly by strep throat disease. So rheumatic heart disease is somewhat very preventable, and treating early will prevent inheriting this disease, especially among the children. So first, we will tackle about what is RHD in children. RHD is a disease that causes permanent damage to our heart valves. It is caused by our rheumatic fever, which is caused also by the tonsillitis or the strep throat. We need to remember that if rheumatic fever affects the heart, it is then called rheumatic heart disease. So the main causes of the heart disease in a child is untreated strep throat infection that leads to rheumatic fever. So which children? So how can we determine the children that are high risk for this disease? So first, children living in poor access to medical health, because it is more likely to miss and untreat the strep throat infection. Also, age children among age of 5 to 15 years old are more likely to inherit. Female children also are more likely to inherit this kind of diseases. So rheumatic fever is also common in high poverty areas, poor living conditions, and children or people who have poor nutrition. So for season, it is also more common in rainy season, especially in the Philippines, which is known as a tropical season. So lastly, it is more common, is found in genetic or genes, in a genetic predisposition. So the next question is, what are the signs and symptoms of rheumatic children? So if we have a child who was diagnosed with this, what are the signs and symptoms for this? So first, we could see trouble breathing. We could see chest pain. Children could also and more likely experience edema, especially in the feet and ankles. We could hear in the stethoscope the heart murmurs. They experience joint pain, rash, skin nodules, irregular or jerky movements. They experience abdominal pain, so they commonly experience abdominal pain, bloody nose, and lastly, these child's formerly and greatly experience fever. So how is rheumatic heart disease diagnosed? So how can we diagnose our child if they have rheumatic heart disease, if they are negative or positive in this disease? So first, our doctors and health caregivers review the health histories, especially the rheumatic fever or strep throat infection history. Also, doctors often do physical exam for our children, a series of physical exam. For the laboratory test, we could include chest x-ray, throat infection, electrocardiography, echocardiography, and lastly, the blood test or blood exam. So, in treating heart disease for positive children, what can we do? So, we have the medical and the surgical treatment for this disease. So for the medications, we need to administer antibiotics. This includes penicillin, amoxicillin, and lastly, healthcare professionals include erythromycin for children. Also, steroids and non-steroidal anti-inflammatory medications are advised for these children and for these patients. Also, water pills or diuretics are useful. For the surgical management, we have three. First, the balloon vulvotomy, the valve repair, and lastly, we are encouraging the valve replacement. For children and patients diagnosed in this condition, nurses also do nursing management and interventions. So for these patients, for the infection especially, nurses administers preventive and prophylactic therapy after rheumatic fever as indicated. Also, we need to continue antibiotic prophylaxis for high-risk patients. We need to prevent this for high-risk patients. We also encourage bed rest, the assessments of vital signs, assessments of signs and symptoms for heart failure, and assess the heart sounds. Also, we are encouraging family teaching, especially for our pediatric patients. So we need to explain the disease condition for the family because somewhat children does not know how to care for themselves in this age. Also, we educate the family about the activities, procedures, and issues that are involved in this condition. So, as we know, in healthcare, prevention is better than cure. So, it is very important that we should prevent as much as possible that our children could harbor and could have this disease. So, how can we prevent rheumatic heart disease especially among our children? So, since rheumatic heart disease is caused mainly by rheumatic fever or strep throat infection, we need to prevent this infection. So we need to have early treatment if our children is suffering strep throat or rheumatic fever by antibiotics as early as possible. So we need to educate parents. We need to educate parents regarding this, and we need as much as possible go to near healthcare workers, to our doctors for checkups. Also, for countries where rheumatic heart disease is endemic, the main strategies for prevention includes improving the standards of living, expanding access to appropriate care. We need also to ensure the consistent supply of quality assured antibiotics, and we need also to develop, especially for healthcare workers among communities, develop and implement program for prevention and control of rheumatic heart disease. So as healthcare workers in the community, we need to encourage the cooperation of the family and educate them as well as possible. So thank you so much, and this is all about rheumatic heart disease, and may that God will bless us all.